Do you know what MEGO is? MEGO? I'm sure you've seen it. It's when you're doing a case presentation and that patient looks back at you and their eyes are glazing over. MEGO. Mine eyes glaze over. At that point, you know that you've lost your patient. Case closed. You're going to get the big fat no, and that's the end of your case presentation. But what happens if you put a structure to every single case presentation you have? You knew going in exactly what you were trying to accomplish, and you wanted to accomplish it in 10 or 15 or 20 minutes. How would you do that? Well, there's a structure to every presentation. And the first thing you need to do is, number one, get their attention. If you're a writer, you know that. It's called the hook. The first line of a paragraph, it hooks the reader. Same thing with your case presentation. Hook the patient into paying attention to what you're about to tell them. Now, I generally do that by showing them another patient. Now, why another patient? Because that's the story we're going to use to set the example of which they're going to relate their story to. Now, remember, you collected a lot of information about this patient at your previous appointment during your examination. So you know about their circumstances, objectives, and temperaments, to use the words of a great dentist. But the point is that you're now telling the story of another patient. And what you're showing them is the before picture. You all know about the before picture because you take them all the time. Hopefully you have a camera, which I talked about before. So you're taking a before picture, and hopefully you get a response from the patient and saying, "Ooh, that's not really nice. That's not what my teeth look like." And then you answer that question. So the point is, there are some marketing people or some salespeople who say to use that early picture to literally shock the patient. You see, we have politicians now who their opening statements, if you listen for them, they shock the public because they're trying to get your attention. The second thing you want to do is remember that the case you're showing, the story you're telling, is about a hero. A hero. A hero is somebody, as we've discussed before, who is faced with a problem and they have to struggle or overcome obstacles along the way. This particular patient that you're about to talk about, she had obstacles. What kind of obstacles? Well, she was afraid of the dentist. Or you might say she had a money obstacle. Or she had a particular technical obstacle that she had to face. But the point is, she had to overcome something and struggle to get to the other side. And she did. And now you show your after picture. And this all doesn't take that long, but this is her story. Doesn't it sound like the same story we talked about before? She overcame that struggle. You show the result. And you always show the positive result. Because you always want to end on a good note. And the good note is, and what you want them to say is, "Can my teeth look like that?" And that's really the dental story right there. The specifics of the technical issues that so many dentists get bogged down to in these case presentations, it doesn't make sense. They're just going to confuse the patient. Tell them the story, and let's move on. Let's ask for a call for action. Let's finally get to the real point. When can we make your next appointment?